Hi, everybody. My name's Jericho. I use she, her pronouns. What I'd like to present to you today is my work with my practicum organization called PAN, where I did an environmental scan of social isolation programs with a specific focus on people living with HIV to support an ongoing research project, which I will get into in just a minute. I just wanted to start by situating myself and this work within the context of a land acknowledgement. I live here on the traditional territories of the Saanich, Songhees, and Cossapsim nations as a white settler. I spent a lot of time thinking about how I wanted to do this land acknowledgement. For one, it is important to recognize this context of colonization. The colonial norms and powers that shape our social systems are directly responsible for the inequities and systemic failures that people living with HIV face, and especially Indigenous people living with HIV. What took me more time to figure out was how to make this land acknowledgement, I guess, purposeful and meaningful for me. As a queer person, I worry about performative allyship. It's something I see all the time with rainbow washing during Pride Month or the rise of trans exclusion in queer spaces and discussion. And so I really want to be careful as an outsider, as a white person, of making those same mistakes. I don't really know what true allyship looks like just yet, and I'm definitely feeling inspired by all the work that you guys are doing and talking about in your presentations, but I just threw this up here as an example where one thing that I'm trying to do is reclaim Indigenous language in a consistent and natural way. And so I put a picture there of somewhere I like to hang out, which is called Megan, but it's better known around here as Beacon Hill Park. Okay. And so I just wanted to start by giving you a background on the HIV landscape across Canada. There's about 65,000 people living with HIV in the country. Rates of HIV transmission have been declining globally. However, since 2020 in Canada, first-time diagnosis rates have been on the rise. There is a confluence of reasons for why this is happening, which I would love to go on at length about, but one thing that I'll just point out that I came across in my paper and the research that I was doing was how Canada has been described as a world leader and hotspot of HIV criminalization. What this means in practice is that people living with HIV can engage in what they rightfully understand to be safe and consensual sex and still be criminally prosecuted for it. And these laws are generally enforced on population groups that we know to be overrepresented in the criminal justice system and also among people living with HIV populations. The slow progression around these HIV laws, to me, demonstrate the prevailing colonial biases with its ties to the historic criminalization of sex, sexuality, and homophobia in Canada, and they are not in line with scientific evidence, despite it being a large and rigorous body around HIV treatment and transmission, and instead it favors harsh penalties as a quote-unquote moral stance. This is a little bit adjacent to the work that I was doing in the project that I had, but it was a focus on my paper. And I bring it up because I think this legal framework provides grounds for stigma and justifies misinformation. And the interactions between stigma and social isolation and treatment adherence are important to contextualize within this broader social system, especially when considering treatment as prevention approaches to HIV care. And so with this in mind, I would like to introduce my practicum organization. It is called PAN, formerly known as the Pacific AIDS Network. PAN is a nonprofit forming a community-based network that addresses a variety of issues, including HIV, viral hepatitis, and harm reduction, among many other things. I specifically worked on the research team on a community-based research project. I really loved doing this work, and I feel really lucky that I get to keep doing it. I had the chance to participate in lots, including collaboration with the community-based research team and also data collection in Prince George. I also feel lucky to have gotten to work with my supervisor, Joanna, who I think is listening, who I both respect and admire as a professional, but who I also really enjoy as a kind and funny person. And so the project specifically was called the TIE Study. It stands for Treatment Adherence, Social Isolation, and Engagement. And the project looks at exactly that, how social isolation might affect treatment adherence, especially for people living with HIV in smaller urban, rural, and remote communities. This is being done through community-based research following the sequence up here of surveys, interviews, focus groups, and eventually community-informed recommendations. And so my project, which consisted of 2 environmental scans, one with a focus on social isolation programs in British Columbia, and the other with a focus on programs for people living with HIV across the country. This was done with the intention of eventually informing a knowledge translation tool for the focus groups, which haven't been held yet, but eventually this should hopefully form a guide to inform discussion and those community-based recommendations. And so just to show you some of the results of the study that might be used for this purpose, I went through and quantified 96 programs and found the general target demographic. So in BC, about 50% of programs were focused towards senior population groups. I also went through and coded each program's description to find the main activities that they were using to mitigate social isolation. By and large, they were group-based activities, and many also centered meals and discussion. From this, several program strategies emerged, including capacity building and low barrier and client-centered principles, peer engagement. There were also several programs that were using, sorry, my transitions are really doing something funny. A lot of the programs use an evidence-based approach to mitigate a secondary public health issue. So as an example, there was a program that was trying to mitigate social isolation for youth living with HIV to improve care retention as they transition from youth care to adult care. I also went through and mapped all the programs. As you can see, there's a huge cluster around Victoria and Vancouver. This bias is to some degree expected. However, the strength of it was more than I had anticipated. It is in a lot of ways highlighting the disparities between rural and urban programming. However, it's also really showing the limitations of the environmental scan. The programs in rural areas are potentially more likely to be multidisciplinary or describe their work in ways that wasn't captured by the keywords or do work informally. And also because this wasn't meant to be an exhaustive list, it's probable that a lot of the programs located in urban areas received higher hits and therefore favored in the study. And so, let's see if it'll... There we go. So why do we do this work? Well, better understanding the how and why people living with HIV are experiencing social isolation can help to mitigate the entrenched inequities that they face and dismantle structural barriers, especially when it's through community-based research. I don't know, sorry. And bringing awareness to the drivers of social isolation, whether it be stigma or colonial systems that uphold and perpetuate misinformation around HIV, can help us move forward and lobby for equity and shift living with HIV from being a highly stigmatized and legal issue into just a regular health issue. And so I just wanted to leave you with a couple of things that we can all do as collective action to support equity and justice. Education is really important. I'm sure many, if not all of you, are familiar with the U equals U campaign, but also while doing that education, dismantling bias and self-reflection. Continued research for and with people living with HIV is also extremely important. It's something that PAN, I think, is a champion in. And the last thing is, I also want to leave you with a book like Reka did, Criminalized Lives by Alexander McClelland. Even though I have lots of experience in harm reduction and sexual health, I haven't specifically done work with this focus before. And so I learned a lot, and the book really added fuel to the fire, so to speak. And that's everything. Thank you so much.